today I actually will only talk about catalysis pretty much, uh, and a little bit about modifying complexes, but I don't really have time, so I'll only talk about my favorite paper, which is the first one, and we will not get into the later papers. And also I modify ligands to study electrochemical properties and the resulting properties of the complexes. So in order to talk about what I do, I have to give an introduction to a reaction that was discovered in 20 years ago in the Weizmann Institute by the Milstein group. And it's acceptorless alcohol dehydrogenation. So then you take two alcohols and you make an ester, and the only byproduct is hydrogen gas. Now, previously, you would need to oxidize one alcohol to make an aldehyde, make an acyl compound out of that, and react it with the alcohol, with the catalyst, to make the ester. So that's 3 steps and a lot of waste. But here, it happens right away. It was just the addition of the right ruthenium catalyst. And of course, you can do the reverse reaction as well. And you can put an ester under hydrogen pressure, and you can get 2 alcohols out. Now, you can do that with amines as well, an amine and an alcohol, and you can make an amide bond. And that's important because amide bonds are present in proteins and in amino acids. But for the purposes of the presentation, let's just talk about alcohols, because even if you stick to alcohols, you can actually do quite a lot of things. It can be very selective. If you have benzylic alcohol, you'll form this type of ester only with an aliphatic alcohol. If you have the diol, you can form a polymer, and you can maybe even use it for hydrogen storage. Now, the papers that I weren't going to talk about, we're going to mention why the mechanism that was published by the Milstein group is wrong. I already knew that at the time when I became independent, but it is important to take a look at the wrong mechanism that everybody thought was correct for a very long time, because it highlights one important thing. So in their mechanism, first you make the dearomatase complex and with base, and this reacts with an alcohol. So the hydrogen from the alcohol goes on an arm, and the hydroxy goes on hydroxyalkyl goes in the ruthenium to form this type of species. And that was called metal-ligand cooperation, because metal and the ligand are both reacting together. Now, the most important thing, however, is that it does do dehydrogenation, and you get the aldehyde right here. And the aldehyde becomes free from the complex, and it can react with another amount of alcohol to make the hemiacetal, which is further dehydrogenated into the ester. But if the aldehyde can react with something else, then you can do other types of chemistry. And that's what I was thinking about. Actually, before the building at my university was built, they gave me money to go back and work a little bit with my postdoc group, which was the David Milstein group. So in 6 months, I came up with this project. And I think everybody knows about the Wittig reaction. It's very simple. You take an aldehyde or a ketone and you react it with a Wittig salt. You deprotonate the Wittig salt. Here, what we can do is we can take the alcohol. And the advantage of that is a lot of aldehydes are not stable, especially at high temperatures. They will do disproportionation reactions and whatnot. So here we can do this chemistry, and this was the first example with non-stabilized Wittig reagent. We can just take any regular Wittig reagent, and there's so many of them. There's so many functional groups in Wittig reagents. So that was right before I came to OIST, while I was waiting for the building to be built in 2015. And after I came to OIST, actually, I used that reaction. Some biologists wanted me to make this thing, so I did it. It's actually kind of tough, but what's important is that this step right here, I use the same chemistry. Instead of making the aldehyde, which requires PCC oxidant, I took basically the alcohol and I used catalytic complex, and we managed to save a step. And this was done on a very large scale, because at the end you get like 100 milligrams of this. Here you're working on a 50-gram scale. And it works really well. So what other chemistry were we doing with alcohols? And for this, I'll actually have to cheat a bit and present a reaction with an ester. And we used ethyl acetate and hexyl hexanoate. And I'll come back to why we worked with esters, actually. But we threw this ester together with the sulfone, with a ruthenium catalyst, dehydrogenation catalyst. And we found out that actually we get, with ethyl acetate, we get the cyclopropane out. And with hexoxanate, we get this linear. We get both products, but we get a crystal structure of only one in each case. That showed that the reaction was very interesting. And when we use mixed esters like ethyl hexanoate, it only showed us that the alcohol part was reacting. So from then on, we decided to only take the alcohol part. And we focused on cyclopropanation first. And this looked kind of different because it seemed like the usual methods for cyclopropanation, this might be the closest, but it's not exactly it. And the Simmons-Smith cyclopropanation, we were not obviously going through this mechanism. And also, we were not doing metal carbene synthesis. Now, we managed to find the right catalyst that took alcohol now, and it reacted with sulfones, 2 equivalent of sulfones, to give cyclopropanes. And the substrate scope was actually pretty big. These are the different types of alcohols which reacted. It was stable for very many functional groups. And we also found that different sulfone partners reacted as well. And if the sulfones had a different pKa, because one of the sulfones had to stay, this one, and one of them had to leave. But if the pKa was the difference was of about 2, then yeah, it works great. You can get a mixed sulfone coupling partner as well. And then we went back and took a look at the linear product right here. And now I'll have to, of course, talk a little bit about the mechanism. And the mechanism shows that, well, first of all, you get dehydrogenation of the alcohol. I wonder, and to get the aldehyde. And this aldehyde is captured by the deprotonated sulfone. And now you can get elimination to get this olefin. And we don't think it proceeds through this because we do a control reaction with the olefin, and we only get a few % of product. It works, but not as well as if maybe there was no olefin. So now the ruthenium, if it stays on this intermediate, it can exchange one of the hydrides for an OH, and then we get the linear sulfone product through accidental reaction. Or if it falls off, if it leaves, if it's then another molecule of sulfone can react with it, substitute the alcohol, and we get cyclization to form the cyclopropane. Now, the SNS catalyst, it favored the cyclopropanation reaction, and we found out that a different catalyst, the PNP, a matcha catalyst, and both of these are commercially available, actually, from Aldrich, favors the linear sulfone reaction. And we managed to make a range of various linear sulfones. So this, including some mixed sulfones as well. So it first reacts with one alcohol, then it reacts with another. That's a bit of a pain. So you mostly just focused on one alcohol most of the time. So now I'll have to go back and say why we worked with esters. And this is actually an interesting story. It's because you have to, it has to do with olefin metathesis. This is olefin metathesis. It scrambles the groups around the olefin. I think a lot of people know about it. The only thing available for esters was transesterification, but thing is, it's not the same because the group R1 and R3, they still retain the acyl group. The true ester metathesis would be if the acyl group moved to R2. So you get these products. That would be true ester metathesis. So we have a catalyst that can make alcohols out of esters and esters out of alcohols. So I thought, okay, well, let's put it in to the reaction with some esters and see if it does that. And indeed, it scrambled our ethyl hexanoate ester and gave a statistical mixture. That was a great result. It showed that true ester metathesis is possible. Unfortunately, it's only limited to hydrocarbon esters. Anytime you have a functional group, it completely kills it, shuts down the reaction. Olefins, halogens, nothing. It's interesting, but it's not really, it wasn't interesting enough to the reviewers, let's say. Reviewers wanted more applications. So I threw in some ethanol as a co-catalyst, and ethanol for this reaction is a hydrogen source, and that changes the mechanism. Once you throw in ethanol, then you have hydrogen available, and now it's stable towards functional groups actually. Of course, ethanol participates in the reaction, so you get a bit of ethyl acetate ester, more things with ethanol as byproducts. But this was also the first example of transfer hydrogenation of esters. The only previous example before that was where they used isopropanol. And the problem with isopropanol is you make a ketone. So you make a ketone from an ester. That's not energetically favorable. So that's why they only had 9 turnovers. This never worked so well. And if you use ethanol, then you make an ester from an ester, then it's energy neutral. So then we threw in 1,000 equivalents of ethanol and with our esters, or even like 20 equivalents for each equivalent of ester. And we managed to do transfer ester hydrogenation and very well. And now it tolerates functional groups. And this was done with Professor Dubé as first author. So let's change topics a bit. I'll talk about my favorite paper from my time here at OIST. And to do that, I'll have to talk about this PNP ruthenium catalyst. It has a very simple NMR, deceptively simple. And first, after the Milstein reaction was discovered, there were so many catalysts that were made for this alcohol dehydrogenation, amide synthesis. And this was just from that time when I made the slide, which was like, I don't know, 8 years ago. If I had to like list all the catalysts now, it would take 3 slides, so better not. So this is a simple complex. It's active in alcohol dehydrogenation. It makes esters. Not as good as others, but it works. And the NMR is actually not that simple. It looks simple, but it's not. You can see like the isopropyl groups are split by hydrogen and by phosphorus, so it's already kind of complicated. So let's make it more complicated. Let's put a pyridine on the arm. And now you can see it's a lot more complicated, but it's still a clean complex. And we have a crystal structure. We have a beautiful clean NMR. And we thought, okay, well, maybe now this will help with catalysis because the pyridine can help when alcohol is bound to the metal. It can deprotonate the alcohol. Maybe it'll work a lot better. And unfortunately, the moment you try to do catalysis with it, you get 0 turnovers. It completely shuts down catalysis. So we took a look at it, and after a very long time, because the NMR is very complicated, we managed to identify 2 species. One where you have, well, it's dearomatized on different arms. One disappears very fast and one sticks around. And then a few days later, if you come back, you actually get a completely different product, which I couldn't identify for several months until finally getting its crystal structure. So product 2B, I don't know if you can see my mouse, but if you look at 2B, you can see that one of the carbons is inserted between the pyridine and the carbon on the arm. So that took several months. And thanks to Shubham, who was the first author on that paper, we finally managed to get a crystal and identify the complex. And okay, it's a bad catalyst. Well, it's not a catalyst at all. But it's an interesting insertion of a carbon into carbon-carbon bond. We also made a bipyridine complex right here, and it's actually does this insertion, but it's a lot slower. And we figured out why that happens, why it's a lot slower, with our collaborators from Israel, who did the calculations on it. And they said that, well, what has to happen is that the pyridine arm has to become dearomatized, and then that binds to the metal, and it kind of inserts between the pyridine and the carbon arm. It's like a transition state, which is a cyclopropane. And they also told us that if we make the terbutyl, it'll be a lot faster because 22.3 kcals per mole, that's like 60 degrees. 19, that's already room temperature. So I made it, I put in base, and yes, by the time I went to take an NMR, 10 minutes later, the reaction was done. We had carbon bond insertion. Right, and that was published in 2019. Now, actually, we're going a lot faster than before, so I could have talked about the other papers, but it is what it is. Let's move on to biological applications of the work. So for biological applications, let's talk about fluoroalkylation. And why are fluoroalkyls important? It's because they, well, a lot of drugs these days, I think about 10 or 20% contain fluorines. And that's because fluorines help molecules cross the blood-brain barrier. Also, it's a lot harder for the body to degrade them, so the half-life increases. So you need to take less of the drug for it to be cleared from the body. So companies are very interested in putting fluorines on drug-like molecules, especially if they can do it at a late stage. If you already have a molecule which is a drug, if you can react it with a catalyst and put a CF3 or a fluorine somewhere on that molecule, it's a completely new species, of course, drug-like species. And you can, maybe it'll work better, maybe it'll work by different mechanism, or maybe it will just last longer by pharmacokinetics in a body. So we work with naphthyridines, which are very strange ligands. This actually came about from our bimetallic project because this is the core of our bimetallics. And they bind to certain metals, first-order metals, in very strange ways, especially copper and nickel. So we Shubham actually made these species, and there was nickel 2, but the moment you put it into air, you make nickel 3, which is already unusual, as long as you have CF3s, which help to stabilize higher nickel oxidation states. So this was published with Julia as a corresponding author, and I participated with that. And what they did was they shined light on the nickel 3, and it released the CF3 radical. The CF3 radical reacted with the substrate, and eventually the nickel 3 reacted with the substrate as well to get reduced to nickel 2, and it was a catalytic reaction with light. And it worked with a radical fluorine source and with the Umamoto reagent, which was considered an electrophilic source, but it's actually active in a radical manner in this particular reaction. I don't have the mechanism slide for it, but I think it's superfluous, especially since it's mostly not my work. But where my work comes in is that after this work, with me and Shubham decided to take a look at the literature, and we found out that it was important for drug companies and people to put polyfluoroalkyls on molecules as well, not only CF3. The problem with the CF3 sources is that the moment you change to a different fluoroalkyl source, they get more expensive. So we needed to find a cheap fluoroalkyl source. This is a cheap one, the one used by Matthias Beller, but the conditions are very harsh, not very good for drug molecules. David Vichich in 2021 showed that hypervalent iodine may be used as a source. And but this wasn't catalytic. So what we did was we made a series of nickel complexes with 2 C2O5s, or with 2 C2CF3s or some other polyfluoroalkyl, and we reacted with the correct Tony reagent. So if it's C2O5, this Tony reagent here needed to have a C2O5 in it. And we basically put it into the reaction. And now without any light, it works. Just add Tony reagent in your substrate. And the Tony reagent reacts with nickel 2. We don't know if we make nickel 4 here because we never see it. And falls apart maybe right away, or maybe it never forms, and we get our radical. And we get our nickel 3 complex, which reacts with the functional substrate to give the functional substrate, and the nickel 2 back again. And we made quite a number of these polyfluoroalkyl species, and even C3 F7 works. And we managed to modify some peptides. Actually, this isn't the best peptide. The best peptide is actually tryptophan, but we didn't know it at the time. So after this was published, we actually thought about it, and we're like, well, there is one very obvious thing that we can do to make a general catalyst that will work with any polyfluoroalkyl source. Like you throw in one catalyst, you give it C3F7, C2F5, it should work. It doesn't matter what. We don't have to change. We don't have to make a new catalyst, a pre-catalyst for each different fluoroalkyl source. And so this is Julia's work right here in 2021. And here's our previous work with Shubham, where we had the ligand-free protocol. But for the current work, we use this C4F8 ligand. And it's a chelating ligand, it's bidentate. And the reason this works is because the bidentate ligands, the chelation effect is much more stable. If you do form the nickel 4, if you have fluoroalkyl going onto the nickel to make nickel 4, this is 10 to the 5 orders of magnitude less likely to leave than this species that you get from the reagent. So the reagent is going to leave as a radical from the nickel-4. And we had Tatiana Gridneva, who calculated the mechanism for us. She works in, she just graduated. She worked in Julia's group. And her calculations, it's the same mechanism. It makes nickel 4. Then it falls apart to give nickel 3 and your free radical. The free radical reacts with substrate, but she calculated that the nickel 4 is sort of stable. We might be able to see it. And we did. We saw it by NMR, actually. So that was really great. So the calculation suggested that we should see it, and it was stable for about 10 minutes. So we can quickly take it to the NMR room, and we measure it. And after 10 minutes, it goes away. But this was proof that this might be the right mechanism, and we do have nickel 4 as an intermediate. And now we use the same catalyst, and we can put CF3, we can put C2F5, C3F7, some ungodly long fluoroalkyl that nobody needs. No problem. What's really interesting is that these Tony reagents, hypervalent iodine reagents, you can make anything. You can put anything on it. So there was this Czech company that made some of these species with a C2O4 bridge. Well, they're kind of hard to make, and they were not the cleanest when we got them, but they still gave us product. It's problematic, but it's a proof of concept. It shows that we can do coupling of two aryls, albeit this is a coupling reaction, sure, between two aryls, but you're going to end up with a C2O4 bridge. That's going to be your limitation, or it can be an advantage, again, if you're looking for drug molecules. And for the yields of these, you don't need high yields. You only need a little bit and you can isolate it. A lot of these are isolated yields, because if you're going to be testing them for disease indications against bacteria or whatnot, then you just use a screen on like a milligram of compound. So that's enough. And in the last slide, we also now we found out that tryptophan is the best one. That's the one that gets selectively fluorinated in all these reactions. So we decided to look at peptides. And at first, I was very skeptical of the yields, but Shubham said this is how people determine the yields in the field. They just look at HPLC, and that's what we did. But we actually isolated some of the small ones, which it was possible to isolate, the ones with 3 amino acids or 2 amino acids. And yeah, the yields are high. I don't know why that is. I think the amino acids help the radical go to the right place, or maybe tryptophan is so good. But we managed to isolate a whole bunch of peptide sequences with these various fluoroalkyls attached to the tryptophan selectively. And we know it's attached to the tryptophan based on fluorine NMR. We know where the signal of the CF2 that's right next to that aromatic ring appears in the fluorine NMR. It's very specific. Now, this was a bit fast, but I think I started a couple of minutes later, so that's fine. This brings me to my most important slide, acknowledgements. I work with the Husnudinova group, who I parasitize postdocs and students from, and they helped me out with the research. And of course, I have to thank Shubham. He was an amazing student. He was first my intern, and then he joined OIST, and I think he has 9 first author papers, 4 with me and 5 with Julia, and of course more as second or third author. And then he went to work with Matt Sigman. He's been there for 3 years now, and he has a couple of Jack's papers there as well. He was looking for a job in the States, but I think with the H-1B visa problem, they didn't want to pay $100,000 for an assistant prof. And he didn't want to go to Europe because he was afraid he might not get back to the US. But now he gave up, and he's looking for jobs in Asia, so maybe even in India. So if you see him apply to your university, he's going to be amazing. He worked. There's not much to do in Okinawa, actually, besides the beach stuff. And if you don't like that, then you might as well. So he just came to the lab and just did stuff that he liked. And of course, I have to thank Professor Dubé. He's sitting in front of the instrument that we used for that paper, ACS catalysis paper, the GCFID. My collaborators from Israel, and OIST and obviously and the government of Japan for funding on lab space. And also thank you for your attention. I'd be happy to take any questions if there's any time left.
Okay, Dr. Eugene, really fantastic presentation. Any questions from the audience? Okay, if there is none, I would like to ask a very quick one. The last work you showed about the amino acid catalyst, did you tried any recyclability test? I mean, how many cycles it can go? Is it
Which
a relevant
catalyst?
question? The last work about the amino acid catalyst.
Yes, yes. No, we did not try any recycle. I don't know if my meeting is it still being shared? Probably
Yes,
not.
yes.
Oh, okay. No, we did not. It's very difficult to do, actually.
Okay, okay, okay.
It's very difficult to
Yes.
get that out. I mean, the smaller ones we isolated, but yeah.
Yeah,
No,
I can understand.
the catalyst is not too stable in the air.
Okay. So if there are no other questions, then we would like a big applause for Dr. Eugene for his nice talk. And hope you will get in touch with us and enjoy the session. So we move to our next speaker. Dr. Kuznik is here. Oh, yes, I can see. Yes.
Good afternoon, ladies and gentlemen.
Yeah, good afternoon. Yes.
Dear
So
Chairman.
we were in Japan. So we just moving from east to west to Poland.
True, yes.
Yes.
Actually,
Yes.
it's still morning in Poland.
Okay.
Okay, so
Very
I'm
good morning to
beginning to
you.
share my screen.
Yes, please.
Thank you very much. Thank you very much for the invitation. I am very honored to present my progresses in actually still coordination chemistry, but my presentation will be much more general than the previous one. So,
okay, great. Let me first introduce you to the audience.
Yes, excuse me.
Yes. So we have now with great pleasure to have Professor Nikodem Kuznik, who is a full professor in Silesian University of Technology, where he is also the vice president of the Scientific Council for Chemical Sciences and the coordinator of scientific clubs. He did his PhD in 2005 and became a full professor in 2025. So his research focuses on the synthesis of aminophenol carboxylate ligands for the selective coordination of iron and to develop bioresponsive and targeted molecular probes for MRI and PET tomography. So with this and without wasting much time, I'm going to hand over to Professor Kuznik. Please go ahead with your presentation.
Thank you very much. Thank you very much for introducing me and for the invitation. I'm honored and I'm very happy to share with you my pretty long time of investigations in this field. But before, I would like to give you some background and to introduce you into the technique of MRI, which is magnetic resonance imaging. This imaging technique is very welcomed by doctors, by patients, due to its non-invasive character. On the other hand, it delivers a very good image due to very high spatial resolution. What I mean by this is the possibility to show details on the level of millimeters, which is quite unique for different imaging techniques in medical diagnosis. What is also unique is the possibility to envisage soft tissues, since computer tomography, the technique which is based on X-ray radiation, is mainly focused on bones. We know that majority of human organs are still soft tissues, and there is a huge need, huge demand for showing these organs in details. And what is interesting for us chemists is the possibility to alter, to enhance this image by administering some chemicals to patient. In this moment, I am not sure whether we can still call it non-invasive, because we give something to a patient, but from medical point of view and medical nomenclature, this is done in this way. But still, before I move to the chemicals, let me just briefly explain you how it works on the molecular level. Since human body is composed mainly out of water, the water plays still important role in diagnosis too. In fact, the experiments are focused on the same phenomena as NMR. So they follow the behavior of water molecules. But here, the most specific feature of water molecule is the relaxation time. Once we put a patient in a high magnetic field, the regular behavior of protons, so 1H nuclides, is observed, but their relaxation is different and specific to the mobility of water molecules in the body. So for this reason, we observed different relaxation in blood, in muscles, than if the mobility is still reduced, it's even lower. But finally, for bones where the mobility of molecules is the most reduced, T1, so longitudinal relaxation, is very different from T2. So we can take both images, T1 weighted images and T2 weighted, and depending on the needs and on the sequence that is used to analyze, we can have a very good and powerful tool. I'm returning back to the image of brain, which shows details of in its structure, which shows also cord. So nerve system is one of the target for this technique. Let me move further and finally begin with chemistry, because as I mentioned before, altering the signal enhancement by giving to a patient certain chemicals is an important issue, not only for us, but also very appreciated by radiologists. You have an image on the left side of a breast tumor, which on the upper part is shown before, prior to giving the patient the contrast agent. But once the contrast agent is administered, then you see enhancement of certain gray part, which might be assigned to a tumor. And this is a very valuable information. If you transform this visual information to quantified way, you see on the chart that prior to administration of the contrast agent, the signal is very low, but then it is multiplied several times, what you see in gray scale on the left side. We have to be aware that for a radiologist, enhancement of about 20% in the grayscale is already valuable and could be recorded by his trained eye. So this brings a very important information for diagnosis. And on the right side, you see one of the most commonly used molecule as a contrast agent. It's a gadolinium complex with cyclic ligand. And gadolinium is not chosen by accident, as for inorganic and magnetic scientists. You know that gadolinium on the third oxidation state has the highest magnetic moment out of most paramagnetic species. But administering just naked gadolinium is too risky because it behaves in a body similar to calcium. So it would mimic calcium, but it will not be calcium. So any presence of free gadolinium is very bad for organism. And this is one of the points I would like to keep you in mind. So the ligand secures stability and fast clearance of the compound out from the body within like 24 hours. It is assumed that 75% of the contrast agent is already left due to high hydrophilicity of this compound. But I have already mentioned you the problems with gadolinium. I will now elaborate a little more on this. Gadolinium is okay, and the structure presented before is, as I said, most commonly used, and this is already like the second generation of gadolinium contrast agents, since the problem arises once a patient has a kidney disorder. This is quite common for patients that if they have some problem with brain, with other organs, they also might have some problems with kidney. And the second generation shown before is already much more safe for patients with kidney disorder. Nevertheless, there is still some share of patients who have serious side effects. It's generally called now in literature as gadolinium issues, gadolinium problems, but there is a disease associated with this known as nephrogenic systemic fibrosis, which is generally not very serious for most of the patients having these problems, but for some it might be very problematic. So in order to avoid this, in order to limit the side effects, we have asked ourselves whether we could replace gadolinium with some other elements. And the most beneficial would be the endogenous microelements, and iron is, from the point of view of physiology, a very good candidate. However, we know that iron is still less magnetic in the sense of magnetic moment of its compound than gadolinium. Nevertheless, we have taken this challenge to render the character of iron compounds to be competitive with gadolinium or to be complementary in certain ways, and I will say it in a moment. But we have to keep in mind that many political, ecological, and other issues are also arguments to replace gadolinium with iron. So we have done numerous studies, and here is one of our last concept showing iron complexes in the role of contrast agents. But we have introduced an additional functionality not found yet in medical practice. The functionality is called bioresponsiveness, which means that the contrast agent, its function, its action in the body is in fact started or launched by certain internal stimulus. So for us, the stimulus was activity of an enzyme, and this is one of the stimulus known and to be specific, to be a kind of biomarker for certain disease. However, it's worth mentioning that there are different stimuli very specific to tumor, like lowered pH, like enhanced consumption of oxygen, enhanced consumption of some other microelements, calcium, and the other studies which you can find literature focus also on this kind of biomarkers, stimuli, which are specific to diseases. Okay, let me now briefly comment on the findings that we got. So we synthesized amino phenolic ligands, which forms a pretty stable cage for iron 3. And these compounds have been functionalized with a sugar derivative. And this sugar derivative is meant to being hydrolyzed upon the action of beta galactosidase, which was proved by us. So initially, we proposed this kind of change, and this was what we were expecting to uncover iron and enable its interaction with water, which would accelerate the relaxation rate of water, and finally it could be observed by MRI. However, our theory didn't work as we expected, what is common for chemistry. So we observed that the spontaneous collapse, the spontaneous decomposition of this phenolic fragment did not take place, while we observed that the phenol was interacting directly with iron. So the idea has been altered by the experiment. Nevertheless, this led us to follow the change, what is in fact the goal. So on the right side, you see the enhancement of the signal by following the R relaxation rate, longitudinal relaxation rate, which changed from 20% up to 40, 60. So this is the change that a radiologist can observe, but you can also do it even if you are not a radiologist, and you can follow this kind of changes. So you see the second row, the first row is water, just to see what kind of images we can get with plain water. And here you see in this second row how you can see water together with the complex. So a solution of the initial compound. And then once an enzyme has been introduced, you see the change in the color. So it became from the bright to darker. For us, it might seem to be like a negative change. Yes, it is, and it is called like this in medicine. So but still any change is valuable. So this is one of our successes, that we could not only show that iron is comparable with gadolinium compounds, but it can also change its signal within the action of an enzyme. Our further research has been transferred to nanoparticles, where we used carbon nanotubes as a support, as a kind of scaffold for iron complexes. You must keep in mind that regular carbon nanotubes, they have an inherent iron residues, iron nanoparticles, which you can see as these dark dots in the internal zone of carbon nanotubes. So they already possess certain magnetic or even superparamagnetic properties. However, they are inaccessible for water molecules, so our functionalization of this carbon nanotubes by the iron complexes I have already shown you before led to enhancement of the image. The TM is just to show the change of the morphology and the organic layer which has been introduced on the surface. Nevertheless, we've done first in vivo images with the carbon nanotubes enriched by our complexes. And you see that it has been injected under the skin of a mouse, which you see this darkening on the left, which definitely differs from the rest of the body around. This is an intersection of the mouse. She was living, and what was also a good result from this measurement was that we could keep this mouse alive and healthy for next several weeks, what is a very good proof of low toxicity of these compounds. That's what was done in Japan, in Osaka. So I'm now moving forward. I'm moving to our next investigations, where we came into conclusion that our experience led us to go further. We have come into a cooperation with Institute of Oncology here in Poland. And they were interested in the possibility of application to PET tomography. This PET tomography is based on some positron emitters, and these emitters are isotopes of fluorine-18, but we were investigating the possibility of introduction of zirconium-89, which is produced in the Institute of Oncology in a cyclotron. So we thought that combining both techniques, MRI together with PET, would be valuable, since MRI carries a very high spatial resolution. I have listed here even below millimeter, but in medical practice, millimeter is fine, and is common for medical scanners. However, the molecular sensitivity of MRI technique is still satisfactory, but you can go further. And PET sensitivity is the one which can deliver us this additional value, because it goes down to 10 to minus 11 millimoles of the possibility to follow any changes. So what we planned to do was to combine both features for the contrast agents, which now has to be called molecular probes, because for a PET, you need to have some source of positrons. So the zirconium 89 was introduced by chelator or directly on the surface of the superparamagnetic iron nanoparticles. But our partners from the Institute of Oncology, they have even more ambitious targets. So they wanted to introduce monoclonal antibodies to target to cancer cells. And we investigated both possibilities: introduction of zirconium via some ligand, via some chelating agent, or direct introduction into the surface of the external layer, which is polymer coating or a dextran, which makes it more biocompatible. So the experiment showed that this direct introduction is more efficient in the sense of speed, which is important because this isotope decays. Its half-time decay is more than 3 days. Nevertheless, if we think about medical application, we need to hurry up, and that was the better approach, which is discussed here. We did several investigations on the chemical character, interactions on the surface of these nanoparticles together with zirconium. We also measured hydrodynamic size to follow the progress, which is important for the medical applications, for its pharmacokinetics and so on. We checked cytotoxicity of the new probes, which were not different from the non-modified iron nanoparticles, and these iron nanoparticles are commonly used in medicine, so that was good. And finally, we were able to measure the visual effect initially in vitro, so we could see that we have a change in the images in the grayscale. You see the comparison of water only. And our last results were to follow how it behaves in the mouse body. So as I mentioned to you, our expectation was to target to tumor cells, which unfortunately was not achieved yet. And we are thinking about this different administrating of these compounds to a mice, or there are modifications. This is still beyond and the future plan. Nevertheless, what we have proved is the possibility of monitoring health state of the mouse by both techniques, by PET, by MRI. What actually could be seen right now is its major targeting to liver and spleen. Nevertheless, the research, the studies are in progress, and we are thinking about other modification. So since my time is running out, I have more or less summarized my presentation. And like the previous speaker, I also would like to introduce the people who were introduced in these investigations. These are mostly my PhD students, my partners, and Professor Kramer-Marek from the Institute of Oncology. But you see also behind us, there is the cyclotron where zirconium-89 is produced. And we appreciate this cooperation. Also, our partners from around the world, Japan, UK, but also others are appreciated and acknowledged for their partnership and good cooperation. Thank you very much.
Thank you very much, Professor Kuznik, for the nice presentation. Audience, any questions? Yes, one question from here.
You used gadolinium-based complexes as well as you used like iron-based complexes. So which one you think is more means active for that their intensity in MRI? So because per gram is like, yeah.
Thank you very much for your question. This is a very important issue. Gadolinium is a commonly used contrast agent. If you have an MRI examination, 70% of patients do not need this contrast agent. So you will probably be asked about your kidney state. And if the doctor decides that MRI contrast agent is needed in your case, he will most likely propose the gadolinium compounds since they are already in the common medicine use. So iron has been already used in medicine. Initially, it was iron citrate complexes, which were by that time worse. I mean, the visual enhancement was not as satisfactory as for gadolinium. So for this reason, it was no use to continue using iron. Nevertheless, if you look for the possibility to apply iron, there are like two groups in the world which consider this, and our challenge is to secure iron stability and reduce the redox behavior of iron. This is what is the problem with iron, that it undergoes very rapid phantom-like reactions, which are bad for organism. So in one of our papers, we have shown that we are able to decrease this redox behavior of iron. And once you do it, the iron becomes much less cytotoxic. But we are also convinced that iron is an endogenous metal. So an organism can handle it much better. So there are several arguments that we can consider iron to put it back, but in a new form. But still, the investigations are on chemical in vitro and in some chemicals in clinical level. So iron might come back. There are also some other features of iron which I haven't mentioned yet. I will just briefly say that with the progress of development of MRI technique, the magnetic field grows. So currently, the magnetic field used for scanners is 1.5 Tesla or 3 Tesla. But with the growth of the magnetic field, the gadolinium behavior decreases.
Okay.
However, the iron behavior is not decreasing that much. So probably with the progress of MRI scanners, it will find its place in medical practice.
Okay. Thank you.
Thank you very much.
So if there are no other questions, then we'd like to have a great applause for Professor Kuznik for the nice presentation. Thank you, Professor Kuznik.
Thank you very much. I
Will be in
appreciate
touch
it
with
very
us.
much.
So we move on to our next speaker.
Good morning, Dr. Joseph Clark. Hi.
Good morning. Yeah, good afternoon to you guys.
Yeah. So it's very morning, right? Early morning in US. So
Yeah.
so thank you for joining us in this morning and bear with us. So we are very happy to have you here. So should we
Yeah,
start?
thank you for the invitation.
Yeah. I will give a brief introduction about you, and then we will go for your presentation, sir. So would it be
Okay.
fine? Yeah.
Yeah,
So
please.
Dr. Clark is assistant professor in the Department of University of Tennessee, and he started there in 2024. He earned PhD of University, and he has been working. He serves as a faculty at Marquette University. Also, his research program is primarily dedicated to precision labeling of small molecules, addressing the challenges of selectivity, incorporating isotope labeling like deuterium, tritium molecule scaffolds. Dr. Clark has received his significant recognition for his research contribution, including for prestigious NSF Career Award in 2023 and NIH NIGMS Early Stage Investigator Award. He is also a recipient of Theme Chemistry Journals Award and the Willie Klinger Early Career Award. So we welcome Dr. Clark, and yeah, the floor is yours, sir. So you can share your screen and presentation. Thank you. Thank you.
All right. Yeah, perfect. Thank you so much for the kind introduction, Abhishek. And thank you for the invitation to speak. Yeah, it was worth the early presentation. So everybody can see my screen and hear me?
Yes, we can
We
see
can
your
see.
screen.
We can see. Yeah.
Okay, perfect. So today I'll be telling you about a little bit about my research program on precision labeling of small molecules. As Abhishek said, I'm an assistant professor in the Department of Chemistry at the University of Tennessee in Knoxville, and I also have an appointment in the Department of Radiology, and this would be at the University of Tennessee Health Sciences, which allows us to eventually translate some of our work into the clinic here. So with that, I'll get started. So the main thing that inspires the work that we do has been this increase in interest, and really this has come about in the last decade in deuterated small molecule drugs. And so there's been significant efforts in developing novel small molecule drugs, and I'll get back to this in a minute. But in addition to that, um, some of the other items that have inspired the work that I do would be kinetic isotope effect measurements, making molecules for deuterated molecules so that we can measure these. This was actually work that I did in my postdoctoral studies with Christina White at University of Illinois. And what's important here is that it really introduced me into how challenging it is to be able to make a molecule such as this one that has two deuterium at a benzylic site. Other applications for deuterated small molecules would be for liquid chromatography, mass spec. This would be internal standards. For example, if you're trying to do metabolic tracing, we do a little bit of that in the research group, and I'd say historically this is one of the main applications. And then there's other applications like studying stereochemical coercive chemical reactions or elucidating biosynthetic pathways. And we've even seen deuterated molecules being used as materials for example, improving the efficiency of LEDs. So back to deuterated drug candidates. When I look at these, if we take, for example, the four Food and Drug Administration approved deuterated drugs that exist. So the first one came out in 2017, and we saw a couple at the end of 2024. And there's like 20 more or 20 plus more in clinical trials right now. If we take a look at these, we can see a couple of things. First, that they do quite well. So deutetrabenazine is they had over $1.7 billion in sales just in 2024 alone. But when we see the structure, and even if we put up some that are in clinical trials, the one common feature is that they all contain aliphatic CSP3D bonds, right? So these are sp3 hybridized CD bonds. And despite the prevalence of aliphatic sp3 hybridized CD bonds in these drug molecules, when we look into the chemical literature, the methods that lead the way, and I think are often thought of as the frontier technologies in deuteration chemistry, they generally are good at accessing or exchanging hydrogen for deuterium at sp2 hybridized carbon. So hydrogen isotope exchange is the general term for these. And when we look at, and this is, first of all, hydrogen isotope exchange is a great technique. It's very useful for late stage deuteration. But the problem here is that when we look at hydrogen isotope exchange for aliphatic deuteration, we see significant problems. And the big problem here is that while this is good at putting a large number of deuterium into your molecule, and this was work by David McMillan that was published back in 2017 in Science, it puts deuterium everywhere in the molecule. And so you can imagine that this compound here is actually like hundreds of millions of different isotopic variations that are all inseparable. So if we compare this, for example, to let's say a CH functionalization, so this again was work that I did with Christina White, where we were selectively incorporating an amine into benzylic positions of a small molecule. Even if we got other regioisomers, say that we got amination here or here, what would happen is that we would just separate those from each other because these are separable with column chromatography, for example. In this case here with McMillan's work, none of these are separable. So whatever your selectivity, your inherent selectivity of the reaction is exactly what you're stuck with. And so the big problem with hydrogen isotope exchange, especially in drug development, is that it's difficult to distinguish H and D from each other. And so if we were to use this, then we have to, have a technique that's extremely selective to just hit one particular site if that's the position of interest for labeling. So our research group, what we do is we develop precision deuteration reactions to access each of these isotopic species where we're controlling the exact quantity and placement of deuterium within the molecule. So you can think about putting 2 deuterium here and 2 hydrogen here, or flipping that selectivity, or putting 4 deuterium or 1 deuterium, doing this at tertiary positions, but then asking really challenging questions. And I'm going to call this the impossible question of how do you do this enantioselectively? And if you could do it enantioselectively, how would you measure the enantiomeric excess or assign the absolute configuration to that particular molecule, and then doing this across at various positions within organic molecules. So I'll start the story off in our research group with the foundation of our program. So what the research that we do is in catalytic transfer deuteration and hydrodeuteration. And in this case, you can think of catalytic transfer deuteration as analogous to catalytic transfer hydrogenation, where we're taking D2, we're adding it across an organic molecule, but it's all coming from a non-deuterium gas source or sources. And so we don't need to deal with any pressures, and oftentimes these protocols are fairly easy to carry out. When we think about catalytic transfer hydrodeuteration, now this adds another element that's interesting, where we're adding HD to an organic molecule, of course, from a non-H2, HD, or D2 gas source or sources, but this opens opportunities or new opportunities for selectivity. And so we reviewed this area recently, so I'd encourage you to check out this mini review from back in 2020. I shouldn't say recently, but about 5 years ago, we wrote a review on this. But what you'll find in here is that our research program is really based in this idea that we take modular copper catalysts and then we operate through both catalyst control and reagent control. So catalyst control is dictating the site of reactivity within the molecule, and reagent control is dictating where we're putting the isotope. So if we do this from a transfer hydrogenation perspective, we're delivering a hydrogen from both a silane and an alcohol across an organic substrate. And if we were to switch one of these, say the alcohol to an OD reagent, then in fact what we can do is we can put a D and an H across that substrate. But you can think about this, that if now we flip this to the silyl deuteride and the alcohol, now we would flip our selectivity. This was shown, I guess our foundational work was published in 2021 in JACS. This was work that was led by Zopa Vang, who's now a senior scientist at Arrowhead Pharmaceuticals, and she was my first PhD graduate. And so I'd encourage you to check this out for more details if you're interested in how we incorporate exactly one deuterium atom into benzylic position, or one deuterium isotope into benzylic positions of small molecules. So the project that I want to talk to you, or that I want to begin with and talk to you more in depth about, is this regioselective alkyne transfer hydrodeuteration reaction. And it's not this one in particular, but this is where we started. So we had published this work back in 2020. And it was an alkyne transfer deuteration, but what we really wanted to do was we wanted to look at this transformation or ask the question, could we develop a new reaction that would incorporate 2 deuterium exactly at the benzylic position of small molecules? The inspiration for this, if we look at drug molecules, FDA-approved drug molecules, especially, what you can see is that these in particular contain hydrogen at positions that are benzylic positions, and benzylic positions are prone to metabolic processes. And so the idea here is if we could, instead have deuterium there, maybe you could enhance the metabolic lifetime, or enhance the metabolic properties of these drugs, or improve the stability of these drugs in biological systems. And so the problem, though, is when we look into the literature, if you wanted to incorporate deuterium into a benzylic position, you run into a couple of common features. And so let's take like what was, I would say, the most advanced technology at the time that we started working on this. So this Angavanti Chemi paper back in 2021, what this group was showing is that they could do a reductive deuteration of this carbonyl group. But here they're getting just a 74% deuterium incorporation. And the way we can think about this is if it's a 74% deuterium incorporation, really you have a mixture of the D2 and the D1. And probably, if we just think about this statistically, you only have about 50% or less of that molecule is actually the D2 benzylic that you want. So I wouldn't say that would be useful at all in making a new drug. So back to the reaction that we wanted to do, we of course want to reach a greater than 90% deuterium incorporation at only this position. We thought mechanistically that we could achieve this through our copper hydride catalysis. And so if you think about this from a reagent control and a catalyst control perspective, from a reagent control perspective, we're going to be delivering our hydrogen from our silane, and we're going to be delivering our deuterium from our alcohol. And catalyst control is going to dictate regioselectivity. So if we make our copper hydride, what we expected is that this would do a regioselective insertion across our alkyne to give us now our alpha vinyl copper species. This alpha vinyl copper species, the way that you can think of this is wherever the copper is where the deuterium will go. So this would undergo deuterodecupration and lead us to our alpha vinyl deuterium species. Now we'd be left with this copper alkoxide species, which could undergo transmetallation to give us our copper hydride. This would add across now this alkene to give us this benzylic copper species, which would undergo deuterodecupration now to give our desired D2 product. Of course, when you have a research idea, anybody who's proposed some chemistry, or especially the faculty in the audience, knows that not everything works exactly how you anticipate it working. And so I go and try this out, and all we find is that, yeah, I would say encouragingly, we found that we're getting decent regioselectivities, but 78% deuterium incorporation is nowhere near where we want it to be. It was also encouraging that we could flip our selectivities, but of course, we're still getting a lot of deuterium at the other position. So we didn't have that good of control in the reaction. Even if we leave out that oxygen functionality or that ether, maybe there was a directing group approach, then we still don't see the types of selectivities that we're really looking for. And so just to look at this compound a little bit closer, it turns out that the 79% deuterium incorporation at the benzylic position and just 7% here, this could lead to 5 different inseparable isotopic products. And I would, challenge you that, or say to you that if you have all 5 of these in a mixture, you cannot distinguish between them. So you can't quantify and characterize these. Even if you combine different spectroscopies, if you were to combine NMR with mass spec, you still can't get a very clear picture on exactly what you have. So we were faced with this, idea that in order to get better selectivities, we needed to first and foremost improve the catalysis, the selectivity in our reaction. But we would also need to develop new spectroscopic techniques that could actually quantify and characterize these isotopic product mixtures. So coming back to the mechanism, I don't have time to show this today, but what we did notice in NMR studies is that it was this step here that was the unselective step. So you can imagine this was highly regioselective. We're forming a benzylic copper species here, and that's the driving force. But in this, it was kind of unclear what exactly is the driving force for the regioselective insertion of that copper hydride across the alkyne. And so we decided to take up studying this, where what we wanted to do is evaluate different copper hydride catalysts that could be used for this regioselective hydrorecuperation. What we were doing is stopping the reaction early, so we would start with, let's say the copper NHC catalyst. We would let this run just long enough so that we get a mixture of so that we don't get any reaction past our alkene, and we would stop it and evaluate our ratios of these two products. And so we hypothesized that if we were getting product A, that this was operating under an electronically controlled transition state. If we got product B, then it would be a sterically controlled transition state. When we move to the DTM seg-phos catalyst, what we find is we do get an increase in our regioselectivity, but it doesn't hit that, at least, with the mark that we wanted was the 9-to-1 mark as a minimum regioselectivity ratio. It wasn't until we got to this ditert-butyl diphenylphosphenobenzene catalyst that, or ligand, that we see a significant enhancement in our regioselectivity. And I have to say, we tried a lot of different bisphosphine ligands for copper. This is just some highlights from that and showing how we progressed throughout our studies. But now that we had identified this ditert-butyl diphenylphosphenobenzene ligand, what we knew is that we could actually operate through this pathway where we got a regioselective hydrorecuperation across our alkyne, and we could eventually arrive at a greater than 95% deuterium incorporation at the benzylic position. And this is exactly what we saw. So I won't belabor the substrate scope here, but just point out that this is reductive chemistry, and despite it being reductive chemistry, we can still get esters to work in this reaction, or nitriles, a variety of different heterocycles, amides, benzyl groups, and we don't see any reductive dehalogenation when we have aryl halides in the reaction. But probably the most important feature in this reaction is the deuterium incorporation. So we're getting extremely high, in fact, the highest ever reported deuterium incorporations at the benzylic position, and exclusively the benzylic position. So 97%, 98%, and wherever I'm showing this deuterium incorporation, that's the only place that we would see it in these reactions. So we're really getting no deuterium anywhere else. This is a very, very clean reaction. we thought that since this reaction was working so well with a variety of different functionalities, that we could actually accomplish a late stage transfer hydrodeuteration. And so Lihan in my research group, he really spearheaded a lot of this work where we evaluated making things like this TUG 469 D2 analog or this naphthafine D2 or estrone D2 analog. The drug that we were really interested in making was inspired from this someterol. So someterol, this has a benzylic position in the molecule that undergoes it undergoes hydrolysis, or I should say oxidation in the body. So this is one of the active ingredients in Advair. And so, a patient takes this and it turns into the alpha hydroxysometerol metabolite in the body. So what we were interested in doing is asking the question, could we actually make, through a building block approach, could we do this on gram scale and then stitch this into the molecule to make someterol? So Lihan was able to do this on gram scale, and in 4 steps, we arrived at our someterol D2 analog. All right. Beyond that, we were also collaborating around the same time with Shoa Peng at the University of Wisconsin. Her research group works on reactive oxygen species activated anti-cancer drugs. And so Donna Stambakova, who recently graduated my group, she was working on this project. So Shoa had published her foundational work back in 2011 in JACS, and she had developed these reactive oxygen species activated anti-cancer drugs. These are just DNA linkers that are activated by high levels of hydrogen peroxide in disease cells. The question that she wanted to answer was nobody had ever done a full metabolic study of these drugs before. And a lot of the problem was that nobody could access the deuterated drugs to be able to carry out the metabolism studies. So you would need those for as internal standards in LCMS. And so she came to us and said, do you think, Joe, that your group could make something, to make these 2 analogs? And I said, well, we can give it a shot. And so Donna developed all this work. She developed both the D0 route and the D5 route. So we could actually make the D5 alkane in 98% yield. This we could do on gram scale. So we start with the D1 alkyne. So we do this exchange reaction just to get that extra deuterium in there, and then carry out the transfer deuteration chemistry. Beyond that, what we did is we were able to hand this off to her group. I think we gave them about 500 milligrams of it. At that point, they made the bronic acid and did the metabolic studies. Okay, so and the full metabolic profile, by the way, is published in our recent paper with them. I just don't have time to go through that data today. I want to stay focused on the chemistry. So if you're interested, again, in some of our D1 work, we've got several publications in this area, in addition to the alkyne work. And the last project that I'll finish up with, I think is something that hopefully is a new topic to you. I find that when I present this work, oftentimes, people haven't correlated this spectroscopy to the chiral molecules that we're working with. And so hopefully you learn something new with this. So we're interested in studying these compounds that are termed enantiositopomers, or that are chiral by virtue of deuterium substitution. So by simply replacing this hydrogen with a deuterium, we end up with a new chiral center. These have been used in a variety of very high impacting studies. So I have no idea how the authors made these enantiositopomers back in 1961, but nevertheless, in 1961, there was this Science publication where they show that tyramine oxidizes at a certain rate. This oxidizes at a much slower rate. And in fact, when they make the enantiositopomers, they find that this oxidizes slower and this oxidizes faster. And what that's telling you is this is really one of the first. This is a really strong study in chiral recognition, where it's telling us it's this hydrogen that's being abstracted by the enzyme. From a synthetic standpoint, we're very interested in making these, of course. It was the Mosier group that had spent a lot of time focusing on the synthesis of these types of molecules. Turns out if you want to make SD1-ethylbenzene, despite the simplicity of that structure, it would take 7 steps and a 34% overall yield. And there's no absolute method that exists to even characterize this. So basically, you can't measure EE and you can't assign the absolute configuration. The first EE measurement wasn't made until 2019 on this compound, but of course, you had to have covalent modifications to your compound. So here's your title compound, but you end up having to place chiral centers nearby this chiral center so that you could determine the diastereomer, and you got to make 2 diastereomers so that you can determine a diastereomer or diastereomeric ratio from the NMR and then extrapolate that back to getting your EE. Of course, this was never going to be a robust technique for EE determination in this type of project. So we wanted to ask like 2 very challenging questions. I'll say one challenging question and one seemingly impossible question. The challenging question was, could we develop the first enantioselective synthesis of enantiosotopomers? The impossible question was, could we determine the enantiomeric excess and assign the absolute configuration to this type of molecule? And so I'll take you through how we arrived at solving these. So the first thing, I started in 2018 as a faculty member at Marquette University. And in 2019 already, we had this result. But what we didn't have was the EE or the absolute configuration. We still had to figure that out. So I'm like, it took a whole year to really think about, exploring every single option of what we could do. And we began collaborating with the Pate group at the University of Virginia doing rotational spectroscopy. And so the idea here was, if we think about our analyte, so here's our analyte. This is the compound that we didn't know if we have R or S, but just for simplicity's sake, I'm drawing this up here. We developed this chiral tagging by rotational spectroscopy. And so this is propylene oxide. That's our chiral tag. And in the gas phase, what's happening in rotational spectroscopy is this is going to bind to our analyte, and it'll form, in this case, a homochiral complex. It's homochiral because the 2 chiral centers are SS. So there's your analyte right there. There's your deuterium. There's the alcohol. This is our propylene oxide. This has an enantiomer that's also homochiral. That's RR. And these are not going to be distinguishable by rotational spectroscopy. However, their diastereomeric complexes will. So the heterochiral complex mirror images, these are distinguishable from the homochiral. So this is RS and SR. So in rotational spectroscopy, this is quite interesting. And I'll give you a clip of what one of the spectra look like. So rotational spectroscopy, the transitions arise due to changes in moments of inertia. And so you can think about, as a neutron moves around a molecular structure, you would actually get different rotational spectra for each of those differences in mass, right? So if a deuterium is at a benzylic position versus homobenzylic, those would give different rotational spectra. And in this case here, what we're doing is we're taking enantiomers and we're turning them into diastereomers by non-covalent bonding interaction. So there's no covalent bonding that's taking place in here. It's all non-covalent bonding interactions. We're making enantiomers into diastereomers. We're going to measure just like you would think about in NMR, and then we're going to extrapolate the EE. So the first measurement that we're doing is actually with the racemic tag. We're not using the S, we're using the RS, and we're going to expect a 50-50 mixture of our homochiral versus heterochiral. So you can imagine that you're seeing here a 50-50 mixture or equimolar in those. And so now we've identified our transitions that correlate to the homochiral and heterochiral complexes. And the trick here now is that when we move to just the enantio-enriched tag, that we get a double. When we see a doubling in our red transitions and the blue go to near 0, we know we have something that's highly enantioselective. Not only that, we can actually measure that EE. We ended up with a 98.1% EE, just like you would in HPLC, although you can actually build a statistical distribution here, so it's a much more accurate and precise EE. And in addition to that, we can assign the absolute configuration because we know that it's this species here that's the dominant species, so we were able to assign this now as the S absolute configuration. So for the first time ever, we have measured the EE of an enantioisotoper and solved the absolute configuration in a single measurement. And so this is a very powerful measurement technique. We can even apply it to the synthesis of SD1-ethylbenzene. So we do our synthetic chemistry here, our transition metal catalysis. And we actually tag this with trifluoroisopropanol. And if you go all the way through here, here's the racemic tag. This now is the STFIP. And we end up at a 97.3% EE. We could do this on gram scale. And if you remember, it was a 7-step synthesis to reach a 97% EE. Previously, well, we did the measurement actually for Mosier. They had a 97% EE. So we can match their EE and we can do it in a single step. We even, this work here, we were approached by the Showmaker group, so Jennifer Showmaker at the University of Wisconsin, to make this substrate for her. We worked on an enantioselective iron catalyzed CH amination together. And so we made a variety of these different enantioisotopomers for that project. You can check out that recently published paper, and this led to some interesting kinetic isotope effect data. All right, so the last project I'll talk to you about, and I just got, I think, 2 or 3 more slides here, is our most recent publication this is a collaboration that we have with Vertex Pharmaceuticals, where we were asking the question, we've covered how do you selectively deuterate benzylic positions, but we were interested now in how do we selectively deuterate allylic positions in molecules. And so we wanted full control over that isotopic pattern, and we thought that allines would allow us the modularity and flexibility to be able to, coupled with our copper catalysis, that we could actually start to access every single one of these species individually in a selective manner. And so this was a project that was spearheaded by Lihan and Ravi. Ravi's a postdoc in my research group, and also a couple other graduate students in my group. And so we started off by looking at how do you build these D1 isotopomers. And so these have the deuterium at this allylic position. One drawback, so this chemistry worked really well, by the way. We get very high deuterium incorporations, we get good yields. One drawback would be if you wanted the D2 or you wanted it per deuterated, you'd have to move to a tertiary center. So we recognized that in order for this to really be useful in drug synthesis, we would need to be able to build the D2 allylic position out. And so we did exactly that. We can get very high deuterium incorporations at that allylic position. And we can extend this to building a variety of different isotopologues and isotopomers with extremely high selectivities. We can even do this to make the D1 allylic enantioisotopomer. So for the first time ever, we made this type of molecule and measured the EE on it. We can get up to a 96% EE. Okay, so finally, we measured this. This is my instrument. Actually, it's at the University of Virginia, so it's in my collaborator's lab, but it's ours. I'll be bringing it to University of Tennessee very soon for some measurements on actually radioactive compounds or radioactive isotopes. So Schenk was the person who he led the measurements on this. And so I'll end there and say that, I'm very grateful to my research group and all of the funding agencies for allowing us to do this work. Of course, the students and the postdocs do all of the experiments these days, and extremely grateful to all of our collaborators, especially you saw the project with Vertex Pharmaceuticals that we just published, but we also have collaborations with Sanofi, AstraZeneca, and a variety of academic labs and other industry labs. So with that, I'll end there. Sorry if I'm a little bit over on time, and I'd be happy to take any questions.
Thank you, Dr. Clark, wonderful talk. So the session is open for question from audience. Anyone want to have any query? So
may I ask, please, sir? I'm here, Dr. Vicky James.
Yeah, sir. Yeah, you can ask.
Professor Clark, this was very nice presentation, and I just have a few questions I have, but because of lack of time, I'll just ask one. Have you performed any study on the water-soluble compounds where you can implement D2O as a deuterium source?
So we have never used D2 gas to do any any of our reactions. So I have no idea if it would, I would guess it would work because there is a chemist, Johannes T-shirt that's in Germany that does some copper catalysis with D2. But we are exclusively working on the transfer deuteration and transfer hydrodeuteration. We've never used D2 gas in our lab for any of the transformations that you saw.
Okay, okay, Professor Clark, I'll contact you soon.
Yeah, please.
By email. Okay,
Yeah.
So
thank you very much.
I also have a query. So
Yeah, please.
in your studies, you are using deuterated molecule, right? So
Mhm.
right now, in means couple of years, I am seeing like there are a lot of papers coming in Nature and even in Science. Like people are using electrochemical method to deuterate the molecules. So how do you think with your methods like chemically deuterating molecule as well as means electrochemically trying to deuterate it, which is more efficient in respect to racemic mixture forming or particular chiral molecule making?
Yeah, so that's a great question. So electrochemistry has been a really powerful technique to incorporate deuterium into small molecules, right? So like I think electrochemistry has opened up new avenues for hydrogen isotope exchange, although that's still in its infancy. But from a reductive standpoint, electrochemistry has introduced a new way and sometimes a mild way to electrochemically reduce say double bonds while you're incorporating deuterium into them. And there was a recent paper, really nice one, I think that you're referring to by Awen Lee, where they could take benzene and electrochemically reduce it and do the reductive deuteration. But I'll caution you with this, that the main difference in our research, so if you really want precision deuteration, right? So you want to control the labeling pattern in the molecule. You want to be able to say, okay, this position right here, we want to put deuterium right there, or you want to do it enantioselectively. There are no electrochemical techniques to be able to do that, right? So the type of control that you're seeing in our chemistry is only possible right now through this transition metal catalysis approach. Electrochemistry, right? It's oftentimes you've got one deuterium source in there and you can't select between the two, different sources. So, if you're reducing a double bond, you're incorporating two deuteriums across there. And so that part's been, of course, shown in the literature quite extensively. And I do think that these papers are rising to the level, in rare cases, Science or Nature, but JACS and this because it's a new way to think about a reductive deuteration, but the selectivities are not comparable to what we're able to get using the copper catalysis.
So one more query I would like to that is related to supply chain. So one of my colleague was asking, right? So right now the war is going on, like from means Russia and Ukraine. So most of the time the supply is coming from the Russia. So do you think like it will continue in this scenario, or you have to think for some alternative to get this the source?
Yeah, so I mean, D2O supply has always been something that's been in question. The US has like a huge stockpile of D2O. I don't know if anybody knows this, but um, the we collaborate with Oak Ridge National Lab. They of course have nuclear reactors, and there's a major stockpile of D2O. So I don't think we'll have any supply issues in theory. We can use D2O in our reactions. We actually have a paper that's under review. I didn't show it today, but we have a paper under review. So any reaction that you saw in this presentation, we can use D2O. So we haven't been limited at all by our deuterium sources. I mean, hopefully things clear up. What the isotopes that's really challenging to get actually is C14. That's the one that with the Russia-Ukraine war, there's no global trade of this. So we're kind of lucky we don't work in C14. But for deuterium, I think we're okay for right now. I haven't seen any price increases yet, but I guess we'll see.
Okay. So, but the gas price is increasing, right?
Yeah, the gas price is increasing, even in the US. Yeah.
Yeah. So we are very thankful for you to you, Dr. Clark, for giving this nice presentation and letting our audience to be aware about what type of work you are doing and how important it is. So we all are very thankful to you, and we will like you will be collaborating in future or something like that. So
Yeah,
yeah,
I would love to. And,
yeah,
thank you for the invitation and being able to speak in front of so many of you,
yeah.
overseas. It was a big time zone difference, but I'm glad I was able to do it.
Yeah, yeah. Thank you, ma'am. So we will move to our next speaker, Dr. Amrendra Singh, who is Associate Professor in Department of Chemistry at IIT Indore. So welcome you, sir.
Thank you.
Am I audible? Yeah.
Yes, yes.
Yeah. So I will give a brief introduction about you, and then I will request you to go for the presentation. So.
Sure.
Uh, So Dr. Amrind is Associate Professor in Indian Institute of Technology, Indore. He obtained his PhD degree from IIT Bombay under the supervision of Professor Pradeep Mathur. He was awarded prestigious CSIR Syama Prasad Mukherjee Fellowship during his doctoral studies. He carried out his postdoctoral research in Sweden as well as in USA, University of Michigan State University. He joined IIT Indore as an assistant professor in 2016 and was promoted to associate professor in 2022. His research work focuses on inorganic and organometallic chemistry, particularly the designing of Princer and heterocyclic carbene ligands, their transition metal complexes for small molecule activation. His work aims at advancing renewable energy and sustainable chemical processes. So we welcome Dr. Amrin sir. So sir, the floor is yours.
Thank you. Thank you for the very nice introduction. And I thank for this invitation, my good friend Abhishek and Shachi, for inviting me to give this talk. It's a pleasure. Unfortunately, I could not be there this time, but it's nice to join you online and give this presentation. Okay, so as my title says that I would like to talk about some recent discoveries that we have found, metal ligand cooperativity via pi-pi interactions. That is something very new that we have recently discovered, and I would talk about it in next few slides. So before I jump on to discuss chemistry, let me first thank my whole group and the funding agencies for all the support, all the work my students do, and the funding agencies provide the money. So later part, if I may forget, so I like to acknowledge them at the beginning. And after that, let me jump to the topic that we want to discuss today is metal ligand cooperativity. And of course, the metal ligand cooperativity is a concept very popular in inorganic and organometallic chemistry, where what we do from a traditional point of view, as you can see here, the reaction. Uh, we can assume that the hydrogen activation happens like this from the hydride goes to the cobalt and the alkene comes in and the alkene gets the hydride transfer goes to alkene and the product is released and the cobalt hydride is regenerated. But what is the difference between this traditional concept of metal catalyzed alkene hydrogenation? If we talk about metal ligand cooperativity, an alternative mechanism we can see is that the hydride generated on the cobalt and another proton-like hydrogen on the nitrogen, they both are transferred to the incoming, for example, a CO bond ketone compound. They are both transferred to the substrate, okay, and the ligand also plays some part during this catalysis. That is why it is called metal-ligand cooperativity. And this concept has been utilized a lot. There is a very nice review in recent in like 2020 where they have explained the different types of metal ligand cooperativity known so far and discussed that in detail. What we can see on these slides is that the metal ligand cooperativity, there are several different ways that the ligand can assist the metal center during catalysis. Sometimes the ligand acts as a Lewis base and the electrophilic part goes to the ligand and metal gets the hydride and the reaction goes like that. Sometimes with a suitable ligand and metal combination, ligand can act as Lewis acid and the metal will act as the base. The electrophilic part of the substrate goes to the metal and the ligand gets the hydrogen atom and the reaction proceeds like that. Then one of the most famous occurrence of metal ligand cooperativity that was popularized by work of Milstein and several other scientists, where aromatization of a ligand happens, and that helps for the activation of, for example, a substrate like hydrogen or something else. And in that case, a lot of examples are there from Milstein and several of his colleagues that they have shown how this type of metal ligand cooperative works. Sometimes a ligand can also be redox active, and it helps in some oxidation reduction processes occurring on the metal. The ligand help can be seen in such reactions by the non-innocent redox active ligands. So these are some of those very popular types of metal ligand cooperativity that we have observed so far. What I'm going to talk about today is that, as you can see in this molecule, it is a simple ruthenium complex with CNC pincer ligand. The structure of this I will show later in detail. But as you can see, a hydride is being transferred to an incoming substrate. But if you see the ligand and substrate orientation, you will notice that the substrate is almost parallel over the ligand framework, and the benzene ring of the substrate is just on top of the benzene ring of the ligand, and pi-pi interactions is possible there. This work was published in Chemistry European Journal, and we were invited to submit a cover art for this. So this is a very interesting new discovery where pi-pi interaction between substrate and ligand helps in outer sphere hydride transfers. That's what we want to talk about today. So before I jump onto that, let me give you some brief background where we are coming from. What is the our course of several years, how we achieved and how we have reached up to this point. As you can see, as introduced by the chair, that our group works on pincer metal complexes, and one of the ligands that we like to use in pincer ligand frameworks is carbenes, N-heterocyclic carbenes. And in N-heterocyclic carbenes, we have published lots of papers based on CNC pincer ligands incorporating N-heterocyclic carbenes, and recently we have developed very the new framework in pincer ligand, where of course protic NHCs are known for some time, but in CNC pincer ligand framework, what we showed that if we do not alkylate one side of the CNC imidazole or benzimidazole ring, this can be converted into an unsymmetrical metal complex, where one side of the CNC pincer ligand has a classical NHC ligand, this side, alkylated ligand, and on the other side we have just a proton. So this is called protic NHC CNC pincer ligand. So we have published some papers where we have showed the phosphine complexes with CNC pincer ligands having protic NHC ligand in the framework. We have shown some phosphine-free complexes with the CNC pincer ligand framework having one classical NHC and one protic NHC ligand. And very recently, Achena developed this even further, and she prepared complexes with just the two protic NHC ligands in the CNC pincer framework. So bis protic NHC complexes we have prepared, and their applications in catalysis we have explored. I'm not talking about their catalytic activities at this point, but then this similar protic NHC architecture we have expanded and introduced a new type of unsymmetrical ligand we have developed, NNC pincer ligand. We call it CPAP for carbene, pyridine, and aminopyridine units that we have in this ligand. What this ligand does is it gives us a handle that we can in this ligand we can have either this nitrogen alkylated or not alkylated. Depending on that, we can have either the alkylated classical NHC ligand here, or if it is not alkylated, then we will have a proton here and we will get a protic NHC. Of course, this proton is beta position from the metal center. So beta nitrogen, we can have protic NHC or classical NHC. And another handle we have in this ligand is this gamma nitrogen, where we can have different types of substituents, either a proton or alkyl group or aryl group. So with this ligand framework, we are able to study the effect of having a beta nitrogen, beta NH group or a gamma NH group. What are the effects of these different types of NH groups during catalysis? As we know that these metal adjacent NH groups sometimes can help in metal ligand cooperativity via protonation, deprotonation, or hydrogen bond with the substrate or substrate recognition. So this kind of metal complexes with the CPAP ligand has allowed us to explore the structure reactivity relationship. Okay, and the beta nitrogen and gamma nitrogen substituents affect the reactivity that we have explored, as you can see in this example. With the alkylated ligand, we get a classical NHC complex, and if we don't do the alkylation, this proton on the C2H that gets tautomerized goes to this nitrogen, and the metal complex that is formed in that case will be a protic NHC complex. We have shown that this complex can be utilized for hydrogen storage applications, where we have shown that LOHC molecules like nitriles or N-heterocycles can be hydrogenated, dehydrogenated reversibly using these complexes, and potentially it can be utilized for hydrogen storage applications. And further, this part was again, and we were invited to submit a cover graphics for this. And after that, the work that I want to talk today starts from this simple chemistry. Very simple chemistry. We prepared ruthenium-3 NHC complexes. As you can see, this is a very simple reaction. Normally, people think that NHC ligands and preparation of ruthenium NHC complexes are tricky processes. You have to have the suitable imidazolium salt, inert atmosphere, and suitable base, perfect conditions required. What we found in this particular case is benchtop stable, rock solid ruthenium-3 NHC complexes can be prepared without any base. Simple ruthenium-3 RuCl3 precursor compound that everybody uses for ruthenium complexes, and this pyridine carbene precursor can be reacted together in PHF reflux condition and gives this ruthenium-3 NHC complex. Very simple chemistry, no base required, halide assisted CH activation happens, and carbene gets generated on the metal center. So as you can see, this metal complex is analogous to ruthenium chloride, actually, ruthenium 3 chloride. Okay, it is still has 3 chlorides here, 1 water molecule, and a chelating bidentate ligand. So whatever chemistry ruthenium Cl3 is used for, we have mimicked that same chemistry. For example, with phosphine, you can prepare a ruthenium phosphine complex where this chelating bidentate ligand is already installed here. Similar to DMSO complexes that can be prepared using RuCl3, similar to that, we can react this precursor molecule with DMSO to get this ruthenium DMSO complex where we already have our carbene. Further, we moved ahead and we can substitute one of the DMSO and chloride with bipyridine and get another molecule. So we have shown that this ruthenium chloride, ruthenium 3 NHC metal complex acts as a fantastic precursor. We prepared phosphine-free catalyst with this, where we, in addition to this bidentate pyridine carbene ligand, we further introduced another tridentate CNC pincer ligand, and we prepared phosphine-free catalyst, which was shown as a fantastic catalyst for nitrile hydration. Analogous to this complex, we prepared